Hi, my name is Amanda Martinez, and I am a second-year medical student at Ohio University. Today I'm going to be going over 2 simple techniques that you can do at home to maybe help out a family member or friend when they have a headache, something that most of us have probably experienced at some point in our lives. Headaches are actually one of the most common complaints in both adults and children and have several causes. Tension headaches seem to be one of the most common types, and the first technique that we're going to discuss is a perfect osteopathic treatment for it. It is called sub-occipital release. It is called this because the technique engages the sub-occipital muscles that attach to the base of our skull at the bone called the occiput. When these bones are tight and need releasing, they can often cause tension headaches and neck pain and upper back pain. My colleague Alana Meadows actually gave a really great introduction to this correlation in episode 2. It makes sense of why the neck and back muscles would relate to headaches, since these muscles are also highly interconnected with our stress response and is where many of us hold our tension in stressful situations. The suboccipital release technique can be used to stretch and soften these muscles to improve back pain and posture actually. And the first thing you want to do is just make sure that the person that you are treating is on his or her back on a flat surface, and you can be resting your forearms at the same level as them. You can find the right place to put your fingers by placing your hands on the person's neck and moving them up towards their head until you feel a very prominent bone. And once you hit that bony base of the skull, move your hands down slightly about 1/2 inch to 1 inch until you find that squishy soft tissue just at the top of the neck. Once you are there, you can bring your elbows closer together, allowing your fingers to spread in a more lateral direction and lean slightly back with your body to allow your fingers to gently pull towards yourself. This will gently add a backwards traction on the person's suboccipital muscles. You can now just hold this position anywhere from 15 seconds to a minute, or until you feel the muscles release under your fingers. You can recheck the area to see if there is a decrease in muscle spasm or tightness, and repeat if needed. Here is a quick demonstration where you can see that the person's head is being fully supported, and the person that is completing the treatment is making sure to find the correct position for her fingers. And after she's doing that, she's going to then apply the right traction that we talked about. And after she feels that the muscles have released, she's going to place the person's head down gently in the original position. The next technique is called the venous sinus drainage. The veins of our head and neck collect blood and return it to the heart as part of our regular blood flow and circulation. This is important when it comes to the headaches because it can ensure that the drainage and circulation in the brain is moving in the best way that it can, and it can help any of the different types of headaches someone can be experiencing. So in blue, you can see this blood flow system that is made up of a variety of important parts called sinuses that essentially collect blood, allowing it to flow in the right places. I want to introduce you to some of the important anatomy before we take a look at the actual technique. The occipital sinus that we will be engaging is essentially located at number 1, which is the bony prominence that we discussed with the suboccipital release. And the transverse sinus is located just on the other side of that prominent bone we can all feel on our heads. Next is the sagittal sinus, which is along the sagittal suture that is all throughout the center of our head. Our skull is made up of 4 main bones, and sutures are basically just the places where these bones fuse together. The last important location I want to talk about is the metopic suture. As you can see at number 1, this is where our skull bones fuse together in our forehead. To do the venous sinus drainage technique, you will start with your hands on the bony prominent, allowing your nails to touch with your palms facing up. Letting the person's head rest on your fingers, allowing the area to soften. Then move to the transverse sinus by bringing your pinkies together, making your hands to form a sort of bowl, letting the tissue soften under your fingers again for a few minutes, and then allowing the sagittal suture to be engaged. Cross your thumbs on either side of that center line and allow a very gentle separation as you slowly move up throughout the head. And then you will finish at the metopic suture in the middle of the forehead by bringing your nails together, but this time with your palms facing down, and slowly move your hands apart from each other. Thank you. I hope these techniques will come in handy the next time you know someone who is suffering from a headache, or maybe if you have one, you can show someone this video and they can help you out.